Hello, I am Dr. Aizaz from MedicoVisual.com, and in today's visual lecture we will talk about development and maturation of lung. So previously we have already discussed that from the superior part of foregut the laryngotracheal groove arises, and then this groove it is converted into laryngotracheal diverticulum, which then divides into two buds, the right primary bronchial bud and left primary bronchial bud, and these bronchial bud they will form the primary bronchi, right and left primary bronchi, which will supply the right and left lung respectively. Now these primary bronchial bud they will then subdivide into secondary bronchial bud, which are going to form the lobar bronchi. So three lobar bronchi which will supply three lobes on right side, and two lobar bronchi on left side that will supply the two lobes of left lung. So we have three lobes of right lung and two lobes of left lungs. So after that these secondary bronchial buds they again then subdivide into tertiary bronchial buds, and these tertiary bronchial buds they are going to form the bronchopulmonary bronchi. So they will form the bronchopulmonary segments, and they will supply each of the bronchopulmonary segments. So we have about 10 bronchopulmonary segments in each lung. So these are called tertiary bronchi. So the development of airways that start from the laryngotracheal groove up till the formation of these tertiary bronchi, these bronchopulmonary segmental bronchi, the development of lung up to this part, it is called embryonic phase. It is called embryonic phase simply because it occurs during the embryonic stage. I mean, it occurs up till the 8th week of development. So from 0 to 8th week of development of the embryo, this phase is called embryonic phase. Then after the embryonic phase, the subsequent phases of lung development, they are termed as fetal stages of lung development or fetal phases of lung development, which are further subdivided into 4 parts that we will just discuss. The subsequent stages, they are consecutively also called as maturation of lung. So now let's discuss the maturation of lungs. So after the formation of these tertiary bronchial buds, they will further undergo a series of subdivisions. They will undergo few generations of subdivision until very small, minute tubes are formed. So these are the tiny hollow tubes that are formed. These tiny hollow tubes are named as terminal bronchioles. So we can say that in this phase, I will tell you the name of this phase later, that in this phase the development is up to the formation of terminal bronchioles. From trachea up to the terminal bronchioles, all these airways, they are conducting the air to the subsequent structures, the structures that are beyond terminal bronchioles. So these airways, they are named as conducting zone or conducting airways. The subsequent structures that include respiratory airways, alveolar ducts and alveoli, they are actually involved in gaseous exchange, and that is why they are termed as respiratory zone. So what we can say is that in this particular phase, the development up till the conducting zone is completed. So terminal bronchiole is the last airway of conducting zone. Now if we cut a section of these terminal bronchiole and we see it under a microscope, you can see that it is lined by cuboidal to low columnar cells, and this gives a false picture of tubuloacinar glands. So due to resemblance of histological picture of a gland, this stage is called pseudoglandular phase, and it starts from about 6th week of development, 6th week of gestation, and continues till about 17th week of gestation, and this is called pseudoglandular phase. So during this phase, some blood vessels are also formed, so there is modest formation of blood vessels in the connective tissue that is surrounding these terminal bronchioles and other airways. So this was the pseudoglandular phase. Then let's see what happens next. In next phase, these terminal bronchioles, they undergo a few more generations of subdivision to form more smaller tubules, and these tubules, these tiny tubules, they have very small, very tiny lumen. But then something interesting happens. Their lumen widens up and they become broad. So they become longer and they become broad. Their lumen widens apart, and as it happens, the surrounding connective tissue, it is compressed, and the blood vessels that were in its vicinity, they become close to these epithelial cells. This process is called canalization. Why it is called canalization? There are two reasons. One reason is that these tiny canals, they widen apart. Some authors also argue that because there is establishment of this special contact between these canals and these bloody canals, I mean blood vessels. So there are lots and lots of blood vessels are seen during this stage. Due to this reason, some authors believe that this stage is called canalicular stage. So there may be two reasons for calling this phase as canalicular. One is that the lumen widens, the other is that there is formation of these bloody canals, I mean blood vessels, and this stage is called canalicular phase. And it starts from 16th week and it continues to about 26th week of development. So terminal bronchiole, first they divide into respiratory bronchioles, and then respiratory bronchioles, they then divide into to form the alveolar ducts. Now respiratory bronchioles, something interesting will happen during this phase with the respiratory bronchioles. So here where the contact of this blood vessel, these endothelial contact with these epithelial cells was established, here these endothelial cells, they will induce these cells to flatten. So these cells, they will flatten. Some of these cells, most of these cells, they will flatten. Most of these cuboidal cells, they will flatten, and they will be differentiated into what we call as type 1 epithelial cells, while the other one that remain cuboidal, they are called type 2 epithelial cells. Now these squamous type 1 flat epithelial cells, they are mainly involved in gaseous exchange, while the type 2 epithelial cells, they will form the surfactant that we will discuss in later lecture. So here also at the place or at the site of contact of blood vessel with these epithelial cells, the epithelium is differentiated into type 1 and type 2 epithelium. In later stages, here some sacs will be formed, and then which will lead to formation of alveoli here. So what we can say is that these, if you look carefully, that this respiratory bronchiole, it is not only conducting the air, but later we will see that it has also formed the alveoli. So these respiratory airways, because of dual function, it is also the part of conducting zone as well as it is also the part of respiratory zone, while the alveolar duct, they will form the alveolar sac and alveoli, so that is purely the part of respiratory zone. Then after this canalicular phase, the next phase starts, and in that phase some sacs arise, and these sacs arise at two places, from the terminal ends of whatever the structure that was last formed, here in this case the alveolar ducts. And secondly, these sacs, they also arise at the site where there was this formation of this contact between the endothelial cells and these epithelium of the respiratory bronchioles or alveolar ducts. And by the way, in the previous phase, I mean in the canalicular phase, as this contact between the endothelium of blood vessels and this epithelium of airways, this was established, what we can say is that this is the formation of primitive most blood-air barrier. So here there will be the blood in these blood vessels, and here there will be the air inside these airways. So this is the formation of primitive blood-air barrier. So that process started in the canalicular phase, and it will further mature in the saccular phase and in further alveolar phase. That will be the next phase. So in this phase, this is by the way called saccular phase, these sacs arise. Unlike the seculars who hate any association of religion with the state, these sacs, they are so religiously attached with the blood vessels, the surrounding blood vessels, that some of the blood vessels of the surrounding mesenchyme, they almost partially penetrate into these sacs. Now what happens with these sacs is that these sacs, they may form the primordial alveoli, or they may undergo differentiation into tubes, and then these tubes, they may then subdivide. So as this happened, initially here there was a sac, but it first differentiated into a tube, and then this tube further subdivided into two more sacs. So as this happens, this precursor part, it has now become a sort of another airway, and now these are now termed as the primitive or primordial alveoli. So because of this reason, some authors suggest that these sacules or these sacs, they must be deemed as a temporary or transitory structures. And this saccular phase, it starts from about 24th week of development, and it continues towards the late fetal period, that is about 36th or 37th week of development. Then in next phase of development, these primordial alveoli, they are subdivided into more and more alveoli. So these sacs, they are subdivided into more alveoli, the definitive alveoli. So primordial alveoli, they are converted into more and more definitive alveoli. And how this happens? Basically, the connective tissue that is separating one sac from the other, this is one sac and this is the other, this is called primary septa. So from these primary septa, some crest arises and they form the secondary septa. So in this way, one sac is further subdivided into many different smaller sacs, and each sac will form a mature alveolus. So let's see how it happens. So let's enlarge this part, and here we can see that this is the primary septa, and from this primary septa the secondary septa arise, and in this way it is subdivided into a number of smaller alveoli. So in this way the surface area of exchange of gases is increased. Now how these alveoli will work? It is very simple, that air is brought into these alveoli and blood is brought into these blood capillaries. So here this is the air, right? So in air we have oxygen, so oxygen will go into this blood, and from this blood CO2 will go back into the air. So in this way the exchange of gases occur in these alveoli, and many tiny small alveoli are formed in this alveolar phase. This is called alveolar phase. One way of formation of alveoli is through this classical pathway, that these sacs, they are divided into smaller and smaller alveoli. Then there is another controversial theory of formation of alveoli, especially postnatally after the birth, and that is called centripetal alveolization. According to this centripetal alveolization hypothesis, these sacs that are present here, they will then subdivide into respiratory bronchioles, and then these respiratory bronchioles, they will then divide into the alveolar duct, and then these alveolar duct, they will form the alveolar sacs that will form the alveoli. So according to this centripetal alveolization, the number of respiratory bronchioles that may increase, but the other widely accepted hypothesis is that there is formation of new alveoli by the subdivision of already formed alveoli. This is the classical theory. Perhaps both of these processes, they occur during this development of alveoli. This alveolar phase, it starts during the 32nd week of development, and it continues postnatally till about 8 years of development. The interesting thing is that the neonate lungs, they contain only 50 to 150 million alveoli at birth, but the adult lung, they contain 500 million alveoli. So these alveoli, they are formed in the alveolar phase, which continues postnatally as well. So as a result of all these phases, ultimately we have here the respiratory bronchioles, which then divide into the alveolar ducts, which open up into these alveoli. So basically these alveoli, they are interconnected with each other, and in this way they maintain their pressure. So finally, let's review what we have read. Hey, sorry for interruption, but this is to inform you that complete course on respiratory system embryology is available on MedicoVisual.com for $4 only. Please buy that course if you want to support our project and if you want to learn complete respiratory system embryology. Thank you so much. Now let's get back to our video. First, there is the embryonic phase, that is 0 to 8 weeks of development, and in this phase the development is from trachea up to the tertiary bronchi, that is formation till bronchopulmonary bronchi. Then there is pseudoglandular phase, in which the development till the terminal bronchioles is completed. I mean the development till the conducting zone is completed, and in this phase the histological section of the lung, it looks like a gland, it looks like a tubuloacinar gland, and that is why this phase is called pseudoglandular phase, and it starts from 6th week up till 17th week of development. Then there is canalicular phase, in which there is formation of tiny tubes which then widen apart, and then there is formation of contact with the blood vessels, and this is the canalicular phase. It starts from 16th week till the 26th week of development. Then there is saccular phase, in which these primordial alveoli or these sacs, they are formed, and it starts from 24th week till the late fetal period. And then there is alveolar phase, in which the previously formed alveoli, they are subdivided into more and more alveoli, and mature alveoli, they are formed. Also remember that in this phase there is remodeling of blood vessels as well and surrounding connective tissue as well, and this starts from the 32nd week of development and it continues till the 8 years postnatally. Before I conclude this lecture, let me tell you something that really angers me. So here is a text from a very famous textbook of embryology, a very authoritative text of embryology, and it states that by 24th weeks, approximately 17 orders of branches have formed and respiratory bronchioles have developed. An additional 7 orders of airways, so focus on this sentence, an additional 7 orders of airways, they develop after birth. You know what this statement implies? It means that till the birth there is only formation of a few orders of respiratory bronchioles only, and almost all the zones, almost all of the respiratory zones, they are formed after birth. Really? So if all the respiratory zone is formed after birth, then I have a very special question for these authors. That after that tiring journey of the baby from the birth canal, the baby is already in need of oxygen. From where he will get the oxygen if there is no respiratory zone? From his ass he will get the respiration. I'm sorry, this really angers me, but from where he can get the oxygen if there is no respiratory zone in his lungs? Of course, this statement is utterly fallacious. This is totally wrong statement. What actually happened, the closest statement that I can come up with is that first 17 orders of airways, they form before birth, but next 7 orders of airways, they continue to develop postnatally. It doesn't mean that this process never starts before birth. It starts before birth. There are 50 million alveoli present at birth, but they continue to develop postnatally. So postnatally, more and more alveoli, they continue to form. It doesn't mean that an additional 7 orders of airway develop after birth. This is totally wrong. They do not develop after birth. They continue to develop. This statement, it implies that these airways, they start developing after birth, which is totally wrong concept. So my dear students, please don't develop the wrong concept after studying these so-called authoritative textbooks of embryology. So at about 20th week of development during the canalicular phase, when the epithelium is differentiated into type 1 and type 2 epithelial cells, the type 2 epithelial cells, they begin to produce surfactant. Now what is the function of surfactant? What they say is that surfactant reduces the surface tension. Now what is the surface tension? Let's not go into details, but I want to give you some concept of surface tension. So here let's enlarge this part. So here I have enlarged this part, and here we have, this is the wall of alveoli, and this is basically a single alveoli that I have enlarged, and here is the wall of alveoli, and here there are water molecules. Now if you look carefully, that the water molecules that are in the deeper layers, they are being attracted from all sides, from up, down, and from all sides. So for example, if we focus on this water molecules, it is being attracted by this molecule from above, this molecule from side, and it is being attracted by this molecule from this side and this molecule from downward. So it is being attracted from all sides. But if we focus on the topmost layer, this is what we call as the fluid air interface. So if we focus at the fluid in air interface, here this molecule, this water molecule is being attracted by this, here it is being attracted by this, and here it is being attracted by this. But is there something that is attracting this molecule from top? Of course not. So it is not being attracted from top. So all these molecules, they are having an unopposed downward force that is pulling them downward. So what it means is that these water molecules, they have tendency to go downwards, and as they will go downward, so here all these molecules, they want to go downward, and as they do so, they have tendency to cause shrinkage of these alveoli. So because of this surface tension, these water molecules at the fluid air interface, they have tendency to cause the shrinkage of alveolus. To prevent this problem, we have surfactant. Now what this surfactant will do is that surfactant has two parts. So here we can see these are the surfactant molecules. They have this hydrophilic part and hydrophobic part. So hydrophilic part, it will embed here into these water molecules, and these hydrophobic tails, they will remain out of water. Now this hydrophilic part, it will be attracted downward, but do you think they can go downward? No, they cannot go downward. Why? Because they have these hydrophobic tails. So these hydrophobic tails, they will prevent the downward movement of these surfactant molecules. So in this way, they cannot go downward. So in this way, one way is that they will not impart the surface tension on their own, number one. Number two is that they are preventing the surface tension, they are decreasing the surface tension between the water molecules. So in this way, surfactant is very important to decrease the surface tension, and if surfactant is not produced in sufficient amount, the baby may go into what we call as respiratory distress syndrome. Respiratory distress syndrome, it is especially common in premature infants. Infants that are born before the term, they are especially prone to development of respiratory distress syndrome. So in preterm labor, glucocorticoids, they can be given to prevent the respiratory distress syndrome. Why? Because they stimulate the formation of surfactant. Secondly, the artificial surfactant may be given to the premature infant to manage the respiratory distress syndrome.